You'll see right now that our guest lecturer is Dr. Pam Ruegg. She is obviously on the left side of my screen. I hope that's right. Interesting. We're very pleased to have a sponsor for this meeting, Marielle. So we want to certainly acknowledge them for their sponsorship. They see real value in this topic. As you can see listed at the top of your screen there, what lower somatic cell count limits could mean to you. And we think this is has a lot of ramifications as we look at where this dairy industry is going. So, Jim, I think we're about ready to lock and load. So I'm going to introduce our guest lecturer here. Of course, Steve Larson.
Before we move to Pam, let me just, this is Steve Larson up here at Hoard's Dairyman, just welcoming all that are aboard. We're glad to have you along for this webinar. It's being brought to us by Marielle and, of course, our cooperative effort with the University of Illinois. So with no further delay, we'll go ahead with our main presenter.
Yeah, let me just give you a couple of quick statements. Pam has got a tremendous pedigree here at this point. She's a professor and extension milk quality specialist in the Department of Dairy Science at the University of Wisconsin-Madison, which she said I had to tell just beat the crap out of Ohio State. Well, maybe anyway. We'll leave it at that. She got her degrees from Michigan State, her undergraduate degrees in DVM, and then got some additional work at the University of California, Davis. She has worked up at the Canadian Atlantic Veterinary College at Prince Edward Island and Michigan State University, had a stint with Monsanto, and is now at the University of Wisconsin working on milk quality. She is one of the experts in the United States and in the world, and currently is the president of the National Mastitis Council as well. So, Pam, we welcome you to our second webinar, and we will let you take control of the program.
Thank you, Mike, and welcome everyone. I am new to this webinar thing, and normally when I speak I have a lot of interaction with my audience members. So I see there's about 38 people out there, and how many of you have figured out how to raise your hands? I see a little thing on here that shows how to raise your hand. Anybody who's figured that out, see if you can do that right now. Let me see if I can see if how many people are actually able to do that.
We got a whole bunch that are raising hands here, Pam. It looks like we got about a dozen right here on our screen.
Yeah, but super. Okay, very glad to see that. And that may help me a little bit as I get some feedback as we go along on trying to figure out how to work with an audience I can't see. I see actually one hand raised right now. But we'll go ahead. So the topic that I've been asked to address today is the topic about how to reach and maintain a 400,000 somatic cell count limit. By the way, out there, how many of you are dairy farmers? Indicate that by raising your hands also.
They go up and down pretty quickly, Pam. We get 6 so far.
So, okay, how many of you would be advisors to farmers? Okay. Looks pretty good. Thanks for that. I think this topic will be equally applicable to everyone out there, regardless of if you're the actual producer yourself or advising producer. I subtitled, or actually put on the top of my title, that a change is coming, and I think that's really relevant to our industry on this topic. Of course, it's always relevant to our industry. The dairy industry is always changing rapidly, but on this particular issue, after many years of a lot of debate, it looks like we're really seeing some change. Now, I'm having a hard time getting my slides to advance.
Okay, we're working. You just keep working on it, and you're in charge.
Oh, there we go. Okay, so I'm going to start off by giving just a little bit of history on how milk quality is regulated. If we take a look at the history of how milk quality is decided and regulated in the U.S., first of all, we have to recognize that our raw bulk milk is routinely tested for somatic cells, bacterial count, and antibiotic residues. This has been going on for years and years. In the U.S., milk is officially tested with 4 samples across a 6-month period. And if 2 of the 4 exceed any of the limits for somatic cell count or for bacterial count, then the producer is notified, and if 3 of 5 exceed the limit, then of course milk sales are suspended. This is just the normal history of how milk has been regulated to ensure that it's safe and high quality in the U.S. Now, when we think about the history of the U.S. somatic cell count regulations, they go back about 40 years. In 1967, the first regulation for bulk milk somatic cell count was put in place, and that regulated the upper limit to be 1.5 million cells per mil. Now, I've been around long enough that I remember in 1986, in fact, I was in private practice in Cull, Wisconsin, when that limit dropped from 1.5 million to 1 million. In fact, I had one producer at that time. I distinctly remember going to this farm. This farmer had 8 cows, and in order to stay legal and be allowed to ship milk, we had to dry off 6 out of the 8 cows. So that was the state of the industry in about 1986. And that was really the first time where, dropping from 1.5 million to 1 million, that I can remember actually having to work with producers individually on the basis of trying to meet these regulations. Because 1.5 million wasn't a very high regulation. The next change came in 1993 when the bulk milk somatic cell count limit dropped to the limit it's at right now, and in 1993 it went to 750,000 cells per mil. And then today you can see I put some question marks around this 400,000 cell limit, because today what we're hearing is a lot of debate on whether or not our industry is going to adopt a new limit. Now let me see again a show of hands. How many of you out there have heard about these rumors about this 400,000 somatic cell count limit? Okay, quite a few of you. Yeah, there's just tons and tons of rumors going on around this 400,000 somatic cell count limit. And let me just spend a minute or two addressing how we got to this today. So the big issue today is that the U.S. dairy industry has changed. It used to be we were almost entirely a domestic industry. So if we had a limit, say, of 750,000 as our upper limit for shipping milk, well, that was the limit that applied to everybody. Well, in the last 10 years, and as the world has globalized, an increasing amount of U.S. dairy production is going into the export market. And in many instances, that exported milk is what makes the difference in whether or not the milk price is going to be profitable for most producers or not profitable. And if you look at 2009, about 9% of actual U.S. dairy production was exported. And if you look at the impact of that between 2002 and how this has changed and where we're at today, in 2002 only $1 billion of U.S. dairy export value occurred, whereas in 2010 we're looking at $3.4 billion. So when we take a look at the nature of our industry, the world market and world market regulations start to have more impact on our own dairy producers here today. And this is even more significant, this world market, when you start looking at the nature of the type of products that are leaving the U.S. So here's the proportion of dairy products that were exported last year in 2010. If you look at the things we think about routinely, things like cheese, as a cheese head up here in Wisconsin, about over 90% of our production is exported from our state, and it's made into cheese and exported from our state, but only 4% of total cheese actually leaves the U.S. 8% of butterfat, but you start looking at some of the pieces of milk, like the skim milk powder, dry whey, or lactose, and you can see that approximately half, or well over half, of some of the byproducts of milk are exported from the U.S. And now we start getting into the issue of, well, what are the regulations for maintaining those export markets and maintaining that $3.4 billion worth of value which has a big impact on the milk price. And one of the things that's really driving the current somatic cell count controversy today is the European Union regulations for imports. Now, in the European Union, there is currently in place a 400,000 somatic cell count limit. Now, the way that they actually administer that limit is not the same as how we administer it here in the U.S. They don't have the 2 out of 4 or 3 out of 5. They have different regulations. But today, just to keep things simple, let's just talk about that as a 400,000 somatic cell count limit. They've had this limit in place for at least a decade, if not longer. And the initial requirement for processors who wanted to export to the European Union was that the milk that the commingled milk that made up the products that were being exported had to meet that 400,000 somatic cell count limit. And so that was pretty easy for the processors to do, because they could simply segregate milk from low somatic cell count herds into one pool, and the products from that pool could leave the U.S. in the export market. So things went along fine. Well, in 2004, now 2004 was how long ago? 11 years ago. In 2004, the EU actually changed the requirement from commingled milk to the fact that individual farms contributing to the milk that contributed to the products that were being exported, those individual farms had to meet the 400,000 somatic cell count limit. So that happened in 2004. But the European Union didn't notify the U.S. until 2009 that the U.S. exporters would have to meet this requirement. So last year I started getting calls from extension agents, from producers, from people advising the industry saying, hey, what's going on with the somatic cell count limit? And initially we heard that there was going to be a July 1 requirement that milk had to meet this 400,000 limit, and then it was October 1, and then it was December 1. And what I'll tell you right now today, the implementation date is not currently defined. That implementation date has been rolled back 3 times, and at this point there's ongoing negotiations relative to the enforcement of this rule that was made in 2004 relative to how the U.S. industry will have to comply. Now, to make this even more confusing, there has been no official regulatory change for U.S. producers. So the pasteurized milk ordinance, which is used to administer the rules for our dairy industry here, has not changed at this point. But there's been a change, or there will be a change, in the effective rules of what's allowed. For example, because the official regulatory limit in the pasteurized milk ordinance is still 750,000 cells per ml, but because most processors will export pieces of milk like lactose or whey or milk powder, what you get into is the problem that processors, in order to be able to compete in the export market, potentially will have to have a somatic cell count of their farms of 400,000, but those farms would still be actually legally able to ship milk according to our current rules. So you could have a potential herd scenario where you'd have a herd today that has an official somatic cell count of 750,000 or 450,000 for 3 consecutive months, let's say July, August, and September. They would be completely legal in the U.S., so there'd be no problem with the pasteurized milk ordinance for milk used in the U.S., but the processor may not want to pick up the milk because of the impact on their export market for their products, such as especially the non-dry powder, or the skim milk powder, and lactose and whey. So huge potential confusion. Thus, what we've seen is a movement in the industry to try to move the U.S. industry towards the 400,000 somatic cell count limit. And today there are currently at least 2 proposals that have been submitted to the upcoming conference, National Conference of Interstate Milk Shippers, who will meet in April. And those proposals are suggesting that the bulk tank somatic cell count limit will be gradually reduced to meet this 400,000 somatic cell count limit by 2014. Now, the National Conference of Interstate Milk Shippers will meet in April and vote on this, and I don't know what direction it's going to go. They may be adopted, and we may see then a gradual movement toward that, or they may not vote on that, and the regulatory limit will stay the same. However, if a movement is made toward the 400,000 somatic cell count limit, we've got some work to do in our industry. So if we think about what the impact would be, the slide that I've just put up now shows data from the National Animal Health Monitoring Service in 2009, and it includes data from 4 federal market orders. So this has about 86.1 billion pounds of milk in it, and about data from almost half the industry, about 32,000 producers. And what this shows is that if you take a look at our current somatic cell count limit of about 750,000 cells per mil, you'll see that virtually all of this milk and about 90% of the producers are complying. So the industry complies with the limit we have. However, if you look at 2009, if we retrospectively would go back and say, how would we have done meeting a 400,000 cell count limit, what you see is now we've got about 89% of the milk, but only about 50% of the producers. So this phased in adjustment to a lower somatic cell count, whether it comes through a regulatory change or it comes because processors need to export milk and are going to enforce it themselves, is going to require a little bit of work by our industry. So change is coming. I think we can say quite confidently that even if the official regulatory limit doesn't change, if the National Conference of Interstate Milk Shippers does not make a change in the pasteurized milk ordinance, we're in a globalized economy, and the health of our price for our dairy products requires us to be able to compete on the export markets. So regardless of what happens, change is coming. And you know, I think I can also say confidently, having been around for 2 other changes in the effective somatic cell count limit, I think we can say quite confidently that our industry can respond to this challenge. We always have. We've got the tools to do it, and certainly we'll be able to respond to this just as well. Okay, so that's a little background on where we're at, and I'm going to then be operating and speaking as we go forward on ways that we can understand and manage the somatic cell counts in milk, with the understanding that our industry's got the most educated producers in the world. We've got the resources to do this. What is it we need to do? Because if we can bring those tools out there to do it, certainly our producers can respond.
Pam, maybe I interrupt you for just a second. There's a question that may be very helpful here and raised. You know, are the milk analytical methods, somatic cell count estimations, comparable in the U.S., Canada, and Europe, so that we're comparing apples to apples?
Oh, absolutely not. And I mean, the analytic methods are comparable for somatic cell count. The analytic methods are absolutely comparable. The way that regulations are applied and the way that the measurements are done relative to a geometric mean versus a arithmetic mean relative to the enforcement, not necessarily the same. And I actually purposely left that out because it takes a lot of time to go through the differences in that, but it's a very, very good question. But I think what we can say overall is it's probably not going to matter much if we're the same or not, because we're trying to get our product into their markets, and they're somewhat trying not to let us in. So we're going to have to comply with their rules if we want to sell to them. So I think the methods that we're going to have to do are, we're simply going to have to adapt. Does that answer the question?
Yep, perfect. We move on.
Okay. Okay, so just as a broad statement, the presence of somatic cells in milk indicates the presence of cows with subclinical mastitis infections in the herd. That's simply a fact. When we have a problem with somatic cells, it's telling us we've got a problem with subclinical mastitis within the herd. It's also important to understand what doesn't influence somatic cells. Somatic cells are not affected by breed of cows. Somatic cells are not influenced by milk yield. In other words, when you think about how somatic cells are expressed, it's in cells per ml of milk, and there isn't a big dilution effect or concentration effect unless you've got very, very low producing animals, so that less than maybe about 15 pounds per cow per day. Somatic cells are not affected by stage of lactation of the cow. In other words, cows in late lactation that do not develop subclinical mastitis infections have low somatic cell counts. So when we look across a herd, we do not expect that cows, the herd that is in later lactation, would have higher somatic cell counts unless there's more infected cows in later lactation. Somatic cell counts are not affected by nutritional management unless indirectly you're feeding a very high concentrate diet that results in very loose feces, which then results in dirtier cows and more exposure to environmental mastitis pathogens. And somatic cells are not affected by other cow diseases. A very common question for me to get is, well, you got a cow and she's got pneumonia, doesn't that cause her somatic cell count to go up? No, it doesn't, because the somatic cells are white blood cells that are normally in the bloodstream of the cow. And they're just circulating around that cow in her bloodstream, and they have no reason to leave the bloodstream and migrate to a point of infection unless there's bacteria there. So they simply don't have any reason to go to the udder unless a bacterial infection has been established. So those are things that don't influence somatic cell. The somatic cell count will be affected by any management practice that exposes teats to bacteria that cause mastitis. And the most common places that cows' teats will become exposed to bacteria would be, number one, from milk that came from the udder of a cow that has a subclinical mastitis infection. And in those instances, what we're usually talking about is exposure to what we call contagious bacteria. In other words, bacteria coming from one infected cow that gets passed to another infected cow when the cow's teats, for example here, come in contact with milk. And you can see here on this mattress, there's a point of potential exposure because this cow's leaked milk. The other primary place that cow's teats will become exposed to bacteria that cause mastitis is when the teats come in contact with moisture, mud, and manure, and the bacteria that thrive in those environments, the moisture, mud, and manure. And in this picture again, what you can see is you've got potential exposure to both contagious bacteria and to environmental bacteria because the teats are coming in contact with both milk and moisture and mud. So these are the things we have to look at managing when we're looking at trying to reduce the amount of subclinical mastitis within the herd. Another thing to think about as we look at trying to meet, say, a 400,000 somatic cell count limit is really the difference between the bulk tank somatic cell count and the individual cow's somatic cell count. Very important to recognize that the bulk tank somatic cell count measures the combined somatic cell count strictly of the milk that is put in the tank. So that means it's not so difficult to manipulate the bulk tank somatic cell count. Only the milk going into the tank will contribute somatic cells. So the bulk tank somatic cell count can be low if quarters are withheld from the tank. It can be influenced by the detection or the lack of detection of cows that have clinical mastitis. So of course those cows with clinical mastitis are supposed to be diverted from the bulk tank, and if they get included into the tank, that can be a source of many somatic cells. The bulk tank somatic cell count is also influenced by the use or lack of use of forestripping. So the bulk tank somatic cell count measures the quality of the milk, but it isn't always an exact measurement of the amount of cows that have subclinical mastitis infections. And here's an important take-home. If you want to troubleshoot a subclinical mastitis problem on a dairy farm, if we need to work on lowering that bulk tank somatic cell count, we absolutely have to know which cows have subclinical mastitis. And the only way to do that is to have individual cow somatic cell count values for each cow in the herd. Because if we don't know if a cow has subclinical mastitis, we can't work on trying to solve the problem. So if we don't have these values, we really have to go get them. Now, when we're looking at evaluating a herd problem with bulk tank somatic cell count, it's important to understand the prevalence of infection. And I'm going to show you just two extremes of what can happen in a herd. Here's my little hypothetical 10-cow herd. So I've got these 10 cows over here, and the somatic cell count in this little herd of 9 of my cows is 100,000 cells per mil. These 9 cows are each producing 50 pounds of milk. And then I've got 1 cow who's got a somatic cell count of 3 million cells per mil. Just so happens that this cow is producing 150 pounds of milk. Does this herd have a somatic cell count problem? Does this cow have a subclinical mastitis problem? Raise your hand if you think it does. Anybody out there? This herd, the bulk tank somatic cell count, would be 825,000 cells per mil. But the prevalence of infection is only 10%. There's only 1 out of those 10 cows that has subclinical mastitis. It just so happens she's an enormously high producing cow. Now, in some instances, you could say, well, this is an easy problem to solve because there's only 1 cow. If you get rid of that cow, well, you've solved the problem. Well, it's not a very easy problem to solve in actuality because nobody is going to get rid of a 150-pound producing cow. So while technically it's easy, logistically it'd be a lot harder. Now let's contrast that herd with this herd. Another 10-cow herd. We've got now 9 cows that have somatic cell counts of 500,000 cells per mil, and those cows are all producing 50 pounds per cow. In this instance, our 1 high-producing cow has a somatic cell count of 100,000 cells per mil. Now in this herd, we've got a bulk tank somatic cell count of 400,000. If we're at a 400,000 limit, now we're right at the borderline. So this herd would not technically meet the criteria for exporting. But in this herd, we've got a really big problem. We've got a prevalence of subclinically infected cows at 90%. This is going to be a very big job to solve a problem in a herd like this. And you know, these are hypothetical herds, but virtually all herds that we deal with bulk tank somatic cell count problems on, virtually all herds that we deal with subclinical mastitis on, fall somewhere on that spectrum. And really what we need to do is go in and establish the prevalence in order to be able to move forward and deal with solving the problems. Now let me show you some real data about subclinical mastitis across I'm going to show data from this region because I have data for this. This is data from January 2011. It's got about 3,600 herds in this data set. So it'd be about really maybe 5% of all herds in the U.S. And this data comes from the AgSource DHI herd summary data. Let me just orient you to this. This blue bar is the percent of each of these herd size categories, ranging from less than 100 cows to herds of greater than 1,000 cows, that have somatic cell count values greater than 200,000 cells per ml. This threshold on a cow basis of 200,000 cells per ml is the threshold we'd say that for an individual cow demonstrates that she has subclinical mastitis. So if you take a look at the smallest herd size category, you can see that about 27% of the cows in herds with less than 100 cows have subclinical mastitis. That value drops a little bit as you increase in herd size. You go to about 23% at 100 to 250, and then it maintains stable just about at that range as the herd size increases. So somewhere around, if you want to average that, somewhere around about 25% of cows have somatic cell count values that indicate the presence of subclinical mastitis. This red line shows the new infection rate, the monthly new infection rate by herd size, and you can see that each month of cows that last month had low somatic cell count values, in other words less than 200,000, but this month have somatic cell count values above that threshold, you can see that somewhere about 10 to 14% of the herds, of the cows in these herds, are developing new infections. So you can see that subclinical mastitis remains an important problem as we move across all herd sizes. The goal that we'd look at for somatic cell count, if you want to jot this down, the top 20% of this data set would show that 80% of the cows can have somatic cell count less than 200,000 cells per ml. And in the top 20% of this database, less than 5% of the cows each month would develop new increased somatic cell count each month. So it is possible, and the goal should be, to have 80% of the cows below this threshold. Okay, when we start thinking about having that goal of having 80% of the cattle within our herds free of subclinical mastitis, the next question is often, well, what's different about herds that have low bulk tank somatic cell count? What's different about herds that are successful in maintaining the production of high quality milk? Often people will ask me, well, what's the one practice that I need to adopt? Well, we've looked at a lot of data on this, and overall what we tend to see is that the low somatic cell count herds basically is a result of the cumulative effect of adopting many of the best management practices that we recommend for minimizing the occurrence of subclinical mastitis. This is some data of ours from 2005 Journal of Dairy Science, and the blue bar that I've got up here right now shows the percent of herds in a data set we have that had adopted 6 separate recommended best management practices. And these herds in the blue are all herds that have bulk tank cell count less than 250,000 cells per ml. You can see that about 70% of these herds use automatic takeoffs, about 40% of the herds remove udder hair using flame, about 80% of the herds have a complete milking routine, which would be a milking routine that includes strip, dip, dry, apply, post-dip. About 90% of these herds almost, the milkers wear gloves at every milking. About 50% of these herds have clinical mastitis records, permanent clinical mastitis records, and about 70% of these herds use the California mastitis test. Take a look at the difference from the herds in the same data set that had bulk tank somatic cell count greater than 400,000. What you'll see is that in every herd size category we look at, fewer of the high somatic cell count herds have adopted all of these practices. There's no one magic practice that results in low bulk tank somatic cell count. It's the result of the cumulative effect of doing the things that are recommended. So, when we look at the somatic cell count of milk from healthy udders, it's very different from the somatic cell count of an infected udder. The somatic cell count from the uninfected quarter or cow is almost always under 200,000 cells per mil. And younger animals especially will have somatic cell counts well under 100,000 cells per mil. This little graph that I'm showing on this side is the somatic cell count of 2/4 of one cow over about an 8 or 9 month period, starting in August and ending in March. This somatic cell count that I've got up there right now is the somatic cell count of quarter milk from the quarter of a cow that has a chronic infection in this quarter with Staph aureus. You can see the cell count starts at 600,000 cells per mil. It goes up to 1.5 million cells per mil. At this period, it drops to 200,000 cells per mil, but it's always high. It's always above 200,000. This is the somatic cell count from an uninfected quarter of the same cow. You can see that it's much lower and it's very consistent. So you can be very confident that when you have a cow, sorry about that, with the somatic cell count of greater than 200,000 cells per mil, these cows have one or more quarters that are affected with subclinical mastitis. And these are the cows that, as we look at trying to influence our bulk tank somatic cell count, we need to be working with. Okay, as we start working with the impacting the identifying and deciding what to do with these cows that have subclinical mastitis, it's important to recognize that we need a history. And what we want to look at is what's happening historically to the somatic cell count in a cow. So for example, we've got this cow Lynette that I've shown up here. And you can see here's her somatic cell count, April, May, June, and July, 45,000, 44,000, 91,000, 142,000. All of those cell counts are below our threshold of 200,000 cells per mil. We'd say those are healthy. But if you take a look at her current somatic cell count at 224, you can see she's got a new infection. And my guess is that actual infection probably developed sometime between July and August. In contrast, if you take a look at Kit Kat, there's a chronically affected cow. 580,000, 409, 523, 1.7 million, and then dried off. This history of chronic infections are cows that often, as we look at trying to influence bulk tank somatic cell count, are the cows we really need to focus on. Now, mastitis is a bacterial infection, and when we talk about subclinical mastitis, we're almost always talking about bacteria that fall into the category that we call gram-positive. And by gram-positive bacteria, I'm talking about bacteria like Staph aureus, Streptococci, and other staph-type bacteria. It's very unusual, while it can occur in some herds, it's very unusual for subclinical mastitis to be caused by like E. coli. Can be caused by some gram-negatives like Klebsiella, But most of the time, if we're looking at most of the herds, we're going to be looking at trying to prevent and solve mastitis problems caused by bacteria caused by streptococci and staphylococci. Now, as we look at trying to solve the problems, we often need to differentiate between contagious versus environmental mastitis bacteria. And I've got a couple pictures up here which will show you the difference really in the point of exposure between them. Contagious mastitis, we're looking at mastitis where the reservoir of the infection is the udders of infected cows. Exposure to these bacteria often occurs during milking. And that's because the exposure is in the infected milk, the bacteria in the milk that came from the infected udders. And the most likely point of exposure would be in the liner of the cow that was milked before the cow. So exposures during milking, and in many instances, we can completely eradicate this disease. And Staph aureus, very common pathogen that we'd think about for contagious mastitis. When we think about environmental mastitis, the reservoir is the environment. And I can tell you right now, if you're looking at the picture of the slide I have up here right now, it's a bad sign when you can see the reflection of your cows in your dry cow lot. That's typically a bad sign relative to mastitis control. The reservoir is bacteria present in the moisture, mud, and manure that the cows live in. The exposure then is often between milkings, or in this instance of this picture I've shown you, it can be out in the dry cow lot. And in this instance, we can't eradicate exposure to these pathogens. What we have to do is minimize exposure. And in coliforms are a great example of environmental bacteria. And increasingly, we've got bacteria that can be transmitted either way. And that would be things like streptococci, the environmental streps. They can be transmitted in both a contagious and an environmental fashion. Another bacteria that can do that occasionally is Klebsiella. So we've got to think both about exposure during milking and exposure in the environment. When we think about a herd that maybe is potentially above a 400,000 somatic cell count limit, what we're typically going to look for first is the presence of contagious pathogens, because the greatest bulk tank somatic cell count is usually caused by the presence of cows who are infected with Staph aureus, strep ag, or Mycoplasma bovis. And you can see that in this slide. This is some data from Pennsylvania Boucher and Giaro looked at. He took 4 bulk milk samples from each of 126 herds. So twice a month he got bulk milk samples from these 126 herds. Then he looked at the cell count or the recovery of Staph aureus. And you can see that herds that they never recovered Staph aureus had on average somatic cell counts of 253,000 cells per mil. Herds where they recovered Staph aureus from all 4 bulk tank milk samples had cell counts well above the 450,000 cell count limit. So again, if we've got a herd that's consistently above this 400,000 cell count limit, we have to look first toward trying to control contagious mastitis pathogens, Staph aureus, strep ag, or Mycoplasma bovis. Now the key contagious mastitis control practices that really work are the practices that have been in place on many herds since the 1950s. And these 5 practices can be very effective at controlling contagious mastitis. First of all, we need to have effective teat dipping. You know, when we look at surveys on teat dipping, we find that about 97% of farms teat dip, but many don't teat dip effectively. In many instances, when we go out and we take a look at the number of teats effectively covered, what we see is missed teats or missed parts of teats. And this is true even if people are using teat dip cups. Second practice, we have to have dry cow therapy of every quarter on every cow, and this would apply to all herds except for organic dairy herds where antimicrobial dry cow therapy isn't allowable. And the purpose of using the dry cow therapy is to treat subclinical infections present at dry off. Highly effective at controlling contagious mastitis. The third key contagious mastitis control practice is appropriate treatment of clinical cases. And we don't know if we have appropriate treatment unless we're recording all the cases and we're monitoring the outcomes. This is a big challenge for many of our farms today. In fact, I'm going to be speaking around our state of Wisconsin on this subject for the next couple of weeks. We also have to look at culling chronically infected cows and making sure that the milking equipment has stable teat end vacuum, effective regulators, and has regular milking machine maintenance. Those 5 steps are the key to controlling the contagious mastitis pathogens. Hey Mike, how am I doing out there for time?
Well, basically, Pam, we're at 45 minutes, and we only have a couple of questions here. So I suggest if you got a little bit more material, you continue on for say another 5 or 7 minutes.
Great, that sounds good. Okay, so let me come back to this. Culling these chronically infected cows, very important part of reducing bulk tank cell count. And so when we think about going into a herd that maybe is above the 400,000 limit, what we have to think about is finding the infected cows and making decisions about their future. So here's some actions we can take to reduce bulk tank cell count. First of all, you have to identify all the infected cows. Easy to do if we've got individual cow somatic cell count values, and we can take a look at those values, find the cows with the cell counts greater than 200,000 cells per mil, and then take a look at making decisions about those cows. This is a typical list that comes from a DHI center. Different centers have different lists, but all of the centers have the ability to come up with a chronic cow list. Find this chronic cow list, last 2 tests greater than 200,000. Take a look at this data and make some decisions. As you start making decisions about chronically infected cows, it's very important to recognize that in most herds, the cows that are at greatest risk for having high somatic cell counts are the oldest cows. Older cows have a much greater risk of having high cell counts, and older cows have a higher probability of being chronic. There's a couple of reasons for this. Older cows have bigger udders, and you know the udders are on the bottom of the cows, and because they're on the bottom of the cows, they get exposed to environmental mastitis pathogens. Older cows have been milking longer, so they've had a longer or a bigger lifetime risk of exposure to contagious pathogens. And then, of course, older cows tend to have weaker teat sphincters because they've been milking longer, and the teat sphincter is the #1 defense against infection. So when we look at the options for handling cows chronically infected with mastitis, it's pretty simple. We find the infected cows and we make individual cow decisions. For chronic cows, you've basically got 6 options. One of the options is treatment. One of the options is to segregate that cow. The third option is to dry off the cow. The fourth option is to dry off the quarter. The fifth option is to quarter milk, so that milk doesn't go into the bulk tank. And the sixth option is to cull that cow. So these are really a summary of the individual cow decisions that you get to make. I'm going to spend just a minute on a couple of those. I just want to make a comment about treatment of subclinical mastitis. Except for cows that are infected with Streptococcus agalactia, it is almost never cost effective to solve subclinical mastitis problems through treatment during lactation. And the reason for that is that except for strep ag, if you treat a cow with a subclinical mastitis infections, your cure rate's going to be somewhere between 50 and about 85%, depending on the pathogen. and you're going to be discarding milk for probably somewhere between 4 to 7 days, depending on treatment. And in most instances, when you look at the difference between the discarded milk and the gain through treatment, it just doesn't cost out in a positive manner. So treatment is not the strategy we want to take in most herds for most pathogens. Another comment just on some of these options. When you look at the isolation of infected quarters using quarter milkers, for example, you have to do this very cautiously. Quarter milkers can be used effectively to keep the highest bulk milk or keep the highest somatic cell count milk out of the bulk milk. But these quarter milkers do not cure mastitis. They cannot be used to keep antibiotics out of a bulk tank. In other words, if you treat one quarter, you can't put a quarter milker on that quarter and use the milk from the other quarters, because the antibiotics are absorbed by the bloodstream, go around, and they're excreted in the whole udder, and they'll contaminate all the milk. Quarter milkers also can be a source of infecting other cattle. They need to be washed and dried after each milking. So when you look at using isolation of infected quarters as a strategy to drop your bulk tank somatic cell count, you have to do this very cautiously. Remember, if you use quarter milkers, that this is a Band-Aid. It may be useful in the short run to help drop the bulk tank somatic cell count, but it can be risky because you're keeping infected cattle in your herd. Okay, second action to reduce bulk tank somatic cell count, make sure you record all your clinical cases in the cow records. You need permanent records of clinical mastitis. We need this to keep them out of the bulk tank, and we also need this to keep track of the relationship between the subclinically infected cattle and the bulk tank somatic cell count. So this is an important issue. Only about 50% of herds that we see out there actually are keeping good records for clinical mastitis. Very important. Also useful in doing a good job in minimizing the possibility of antimicrobial residues. Third action to improve bulk tank somatic cell count, get rid of some cows. You know, I've got a saying that I say sometimes, should we treat them or should we eat them? In many instances, they're more valuable for eating than they are as milking cows. Cows that should leave your herd are cows with Mycoplasma bovis infections, cows with chronic Staph aureus infections, cows that have multiple quarters that have recurrent infections, cows with more than 3 clinical cases, cows with teat end damage, and older cows with a history of chronic mastitis. In most herds, these cattle are costing you more in the herd than they would out of the herd. So, fourth action to improve bulk tank somatic cell count, identify the points of exposure to the bacteria. I'm just showing a few pictures here to show the diversity of points of exposure. Here we got biosolids, which just are very difficult to manage relative to milk quality because they're just a great place for bacteria to grow. In this instance, we've got a compost barn down here. Very difficult to manage compost barns, at least up in our part of the world, because it's really hard to get enough sawdust to keep that compost going. We've got some instances where we got animals on pasture, and they may have calves with them, and we get cross-contamination. And then we've got a bunch of people who have older barns with cattle that are really a little too big. They've got modern cattle and older barns, and we get a lot of exposure to environmental issues. And it's hard to keep the cows clean. We also get issues with teat dipping. This is a real picture. Unfortunately, this is a rare circumstance, but we do see it. That's a dry cow lot. Not very dry. And of course, we get issues down here with transference between cows of contagious pathogens just due to the milk within the liners. So, when you look across some of our actions that we need to take on our farms to reduce the bulk tank somatic cell count, basically we've got to ensure that every farm has a milk quality plan. And every farm has goals. So, kind of to sum things up, as we look at putting a typical strategy in place for reducing bulk tank cell count, first of all, you want to perform a bulk tank culture to look for Staph aureus, Strep Ag, and Mycoplasma bovis. Because remember, the highest bulk tank somatic cell counts are found in herds that have contagious mastitis problems. Secondly, we need to review the monthly individual cow somatic cell count data. Identify our cows with our high cell counts, identify the chronically high cows, and make some individual cow decisions. To make those individual cow decisions, we need to culture some of these quarter milk samples. So we take milk samples from the high somatic cell count cows, submit them to a reputable laboratory, and determine the type of pathogen causing the mastitis on the farm. We want to review the clinical mastitis records, identify the chronic cows, and again come back to making some individual cow decisions. And then finally, we want to make a milk quality plan based on that data. So when we look at solving mastitis problems, it's technically easy. The things I've described aren't rocket science. We basically need to find the infected cows, determine why they get infected, and then decide how to stop new infections. What management changes need to occur? Very simple process. However, solving herd somatic cell counts is hard to do alone. I would advise everyone out there to think about identifying a farm management team of advisors to help solve the problem. Get the veterinarian involved, get the dairy field rep involved. Have a monthly meeting focused specifically on reducing cell count. And within that monthly meeting, have goals for cell count, actions and ways to assess those actions, responsibilities for each team member relative to the actions, target dates to complete the actions, and times to evaluate progress. So with that, we'll come back to change is coming. Bulk tank somatic cell count limits are falling. Herds can achieve improved bulk tank somatic cell counts by adopting a comprehensive group of best management practices. And the keys to improving bulk tank somatic cell count is simply know which cows are infected with subclinical mastitis, prevent new infections, and work with a team to implement change. So with that, Mike, I can take any questions we've got out there or get some new ones.
Okay, Pam, can you push the PowerPoint that lists our next PowerPoints? Yep. We'll do that, and then we'll push the next one in a minute. Let's wrap up here quickly. Pam, thanks very much, and we will take questions. We got about 6 or 7 at this point here. We want to mark your calendars. March 14th will be our next Hoard's webinar. It's how milk production control plans compare, and our instructor will be Dr. Mark Stevenson from the University of Wisconsin. On April 11th, we'll be looking at fine-tuning dairy rations, and that'll be with yours truly. Pam, can you push the next PowerPoint if you could, please? That would be good, and we will go into our Q&A, and certainly we want to thank you very much for an excellent seminar, a very, very logical approach here, and of course Hoard's Dairyman as well, and Steve, you may want to say a few comments at this point before we go into the questions, and of course recognize our sponsor today of Mariel. Steve, any comments? Steve doesn't have too many comments yet. Well, let's move forward into our Q&A. So again, Mariel, thank you very, very much. One question, Pam, that came up here, and that is, if you had a heifer that was on DHI and was 50,000, would you dry treat all quarters if you were confident, you were sure based on data that this was a clean heifer? We get that question quite a bit.
Yeah, you know, in most instances, my answer is yes. In most instances. And it's not because necessarily that you're going to, in that instance, probably treating an infected quarter, but as that heifer dries off, I want to make sure that she doesn't get infected during the first couple of weeks of involution during that dry period. Really critical phase is during involution. Most of the infections during the dry period will come immediately after you dry off the heifer or immediately before she calves again. And the use of dry cow therapy will help prevent new infections during that stage.
Pam, another question came up, and that was earlier. The two proposals you mentioned, National Mastitis Council and National Milk Producers, are they similar? Are they much different, the two proposals you mentioned?
The two proposals are more similar than they are different. They both have a phased-in approach to lowering the somatic cell count limit. There's some technical details that are different within them, but they're actually more similar than different.
Pam, another question came up. In your Journal of Dairy Science article, you had 6 bar items or 6 items listed there. Were those the most important 6, or how did you select those 6 when you're looking at infected versus clean herds?
Yeah, that's a very good question. We looked at lots and lots of management factors. Those were management factors that would probably be the more common factors that people use. But we looked at many management factors. And overall, we were actually in that, one of the objectives of that particular analysis in that study was to try to identify if there was 1 or 2 or 3 things that were absolutely more common in the low somatic cell count herds as compared to the high. And basically what we found was it's just the comprehensive adoption. And other people in their studies have done the same. But in that overall paper, if you go in and look at, we looked at a lot of other practices as well. I just abbreviated it so the slide is actually comprehensible.
Pam, another question. A case study here with a herd of 500,000 cows. It could be a foreign herd, actually. And they have mycoplasma in the herd. How can we eradicate it? I think it's early.
Yeah, Mycoplasma bovis herds are solvable. But you first of all have to identify all the infected cows. And then depending on the prevalence of it, if it's just a few cows in a herd of 500 cows or whatever, if I had 20 or less cows, the fastest, most expedient way to get rid of it is to get rid of all the infected cows. Some herds that's not feasible because there's too many infected cows, and then a strict program of segregation, isolation, and really, really hygienic practices during the treatment period, the fresh period, the dry period are really important. But the best way, if feasible, is to get rid of the affected cows.
Pam, another question on J vaccine program. Is it helpful in the long run for the JVac vaccination program?
Yeah, the JVac vaccination program is targeted toward gram-negative infections. So in most herds, it'll have a bigger impact on the severity of clinical cases rather than, say, a bulk tank somatic cell count or the amount of subclinically infected cattle. But for most herds, most of the time, the use of that J5 or the gram-negative vaccine is going to be cost-effective because what it does is really decreases the severity of the symptoms of cows that get infected with these gram-negative pathogens. And decreasing that severity is pretty important relative to saving lives of cows.
An interesting, good question, again, from a foreign country, but it would apply to us in the U.S. If I don't have somatic cell on DHIA, what should I do in terms to try to get a handle on reading cows?
Okay, so your options on that are you really do need to know if the cows are infected or not, and there's a number of individual rapid cow tests that you can use to generate your own data relative to the somatic cell count of affected cows. The one that's been around longest is the California Mastitis test, and normally you just have to read that as either positive or negative. And positive would mean you'd have 1 or more quarters that you get any thickening of the gel, because any thickening of the CMT gel indicates that the cell count is at least 200,000 or above. Another test, there's the Porta SCC and there's the D-Level Direct Cell Counter. All of those tests are accurate at identifying cows with subclinical mastitis infections. But you really have to generate that data if you don't have access to it through a DHIE center.
Maybe another question may be difficult to answer, Pam, and that is, obviously you were recommending treating for subclinical mastitis during the dry period. Do you have a protocol to share on that? Is that a long answer?
No. I don't know if this is a U.S. Or an international attendee, but in general, we would recommend the use of a commercially available dry cow treatment that has proven efficacy data, which in the U.S. all of the dry cow treatments would, but what you want is a reputable dry cow therapy and that has a long history of success. And all of the commercially available dry cow treatments available in the U.S. have good efficacy data on them.
Do you have to combine that with identifying the causative organism or not, Pam?
For subclinical mastitis at the end of lactation, you can probably select overall one of the dry cow treatments based on some knowledge of pathogens. You should have some knowledge. Yeah, you should. It would be good to have some culture data.
Okay. Another question in this end here was chronically infected. We weren't sure. A cow is chronic. How do you define a chronic cow if I have somatic cell count data?
That is a wonderful question. I actually have a whole talk I give just on chronic cows.
Pam, we don't have time for a whole talk here.
And I spend half or maybe a third of that talk talking about what a chronic cow is. There's no universal definition of what a chronic cow is. On most DHIA centers, it would be a cow with 2 somatic cell counts or more above the 200,000 threshold. But you'd also have to say cows could go up and down across a lactation. Cows can have multiple cases of clinical mastitis, and we shouldn't forget about those. So you really just need to look at that history of the cow and get a pretty good idea of what's her trajectory. Is her trajectory somatic cell count going up or fluctuating, or is she a cow that's got, a cell count that's consistently low? But in general, at least 2 cell counts above 200,000 or a history of multiple cases of clinical mastitis.
Pam, are you okay? We keep getting more and more questions. Are you okay?
Yeah, I'm fine.
Okay, well, listen, let's go to our next one here. Again, comes, what about frequently milking cows with oxytocin as a treatment for mastitis?
That's a great question as well. Pretty much all veterinarians were taught to do that. I was taught to do that. It seems like a good idea. I mean, just logically, if you've got a cow with mastitis, it seems like a good idea to remove that infected milk and all the clots and everything. There have been 3 studies that have looked at the impact of frequent milking on cows. None of them have shown any benefit. So the scientific data doesn't support that practice as improving outcomes after clinical mastitis treatment. But there may be some non-identifiable benefits, such as if you are frequently milking a cow, certainly you're observing that cow more frequently, and that may be helpful. But the scientific data doesn't show that that's something that you need to do.
Jenny asked the question, do you recommend drying off by stopping completely or going to a once-a-day milking period for a time to lower the production level?
That's another excellent question. For years, decades, I recommended abrupt dry-off because that's what the data showed. But there's some data coming out now. I wouldn't say it's conclusive yet, but there's some data showing that, exceptionally high-producing cows, there may be some benefit relative to milk quality to do a more gradual dry-off because leaking of milk is a huge risk factor for the development of mastitis. So it may be advantageous in some of these cows to, of course, you need to reduce the feeds, maybe some limited withholding of water, of course, but once-a-day milking in real high-producing cows might be useful in some instances.
Jason raises an interesting question. I wish we all had this problem. Perhaps we do culture where Jason says and have an average bulk tank somatic cell count below 50,000, and they're in the U.S. and they're milking about 60 cows, a smaller herd size, and looking for a way to maybe get rid of several cows, 5 that have more than 75,000 SCC of infection. Is that possible? I'm suspicious. I'm wondering if he's wondering, that the counts are so low, Pam, that is that a problem?
I wouldn't say that. Is it the question, are the counts too low? Is that the question? Or is the question what to do with these cows?
Yeah, I think it's a little bit. I'm Monday morning quarterback. He's got 5 cows over 75,000 and questions if there's a way to will they respond.
I have no idea. In those instances, I mean, first of all, congratulations. Excellent, excellent performance. You should be nominated for the National Dairy Quality Award, so we could learn from you. But secondly, I'd say in a herd like this where you're really concerned with low bulk tank somatic cell count, what you really need to do is determine the pathogens in those 5 cows. I would recommend probably quarter milk samples on CMT positive quarters in those cows and then make decisions on how to deal with them. It's unlikely that treatment would be one of the options you'd want to consider.
Another question just came in from Dubai. I noticed some heifers get mastitis during the summer here. I assume heifers are first lactation animals. What kind of mastitis is that? Or, Doc, do you want to indicate these are heifers that haven't calved yet? Pam, how do you want to interpret that?
I'm going to interpret that as heifers that haven't calved yet. That'll be my interpretation of it. I'm actually working on a paper on that right now. That's what I'm going to do when I get off of here. Heifers can get mastitis. You need, again, the most common bacteria that cause mastitis in non-lactating heifers are staphylococci, and it varies regionally by if it's coagulase positive staphylococci, which would be Staph aureus, or non-Staph aureus staphylococci, which we call coagulase negative staphylococci. But regardless, you need to have some culture data either on those animals after they calve, or if you see visibly swollen quarters, you can take the secretion from that and culture it, and then the control plan needs to be made based on what those bacteria are.
Pam, we're going to wrap up here because we're going to attack you too much here. So there was one more question about keratin. If you see that, you can read that, and I'll come up with it. The other question about the PowerPoints, we do not distribute the PowerPoints. Dr. Ruegg controls those, and so I guess if you want to try to get a set of her PowerPoints, you'd have to contact you directly, Pam. That's how we will handle that at this point. They're obviously they're online. You can see them, but you can't download them at this point. Keratin plugs. A Canadian colleague asks, looks like some teats don't have a natural amount of the natural plug, the keratin. Comments on that?
Yeah, that's true, and the Canadian research is excellent on that. What we're seeing today is that the cattle today, you can have up to maybe 40% of the cattle that as they go into their dry periods, maybe by 6 weeks into the dry period, that's toward the end of the dry period, still haven't formed an effective keratin plug, and that's a change over time. And what that tells us is that those teats can't handle as much exposure to pathogens as a teat that's got a good keratin plug, and that just reinforces the real importance of maintaining a very clean, a very dry environment for those dry cows, because it's exposure to the bacteria that result in mastitis.
Okay, last question, Bruce. You just snuck in, but this is the very last question, and Pam will thank you very much for all your effort there, and that is, can somatic cell counts be too low? He's using 100,000, meaning that is that compromising the cow's ability to combat a challenge?
Probably not. While there is some data that shows very, very low somatic cell counts, like in the 25,000 cell range, those cows may have a slightly increased risk of clinical mastitis. There's many herds out there. There are thousands of herds nationally that maintain herds of cattle with cell counts under 100,000 cells per mil and almost no clinical mastitis. And so my answer routinely to that question is probably not for most herds.
Okay, well, we're going to wrap this up here. Lots of good questions at this stage of the game. First of all, a comment that if you want to listen to this one or previous webinars, you go to the Hoard Dairyman webpage. In the upper right-hand corner, there is a button you click on, and you can actually listen to this webinar or previous ones as far as that goes. Dr. Pam Ruegg, we thank you a million for your dedicated effort and an excellent presentation. We appreciate that very, very much at this point. Our thanks to Marielle for their willingness to sponsor this webinar. That's very helpful to bring these to you without a charge to people who are participating here today. And at this point, Pam, any final words of wisdom?
No, thank you very much. Very interesting process.
Well, we hope we'll
Mike?
see everybody back here on March 14th with Dr. Mark Stevenson on another timely topic area. Our thanks to Hoard's Dairyman for their continued support, and Jim Baltz, thank you for your efforts here. We stand adjourned, and come look at the archives here. It'll be on the Hoard's Dairyman webpage. Have a good day.